Welcome back to Ellie Scrubs In. This is part 5 of our surgical instrument guide, and by now, you've seen 40 essential tools of general surgery. Today, we'll round that out to an even 50 with 10 more instruments that shine in procedures like bowel resections, vascular repairs, pelvic surgeries, and soft tissue dissection. These aren't just tools, they're precision extensions of your hands. Let's scrub in. Dennis Intestinal Clamp. The Dennis clamp is a classic tool in bowel surgery, long, curved, and non-crushing. It's designed specifically to occlude the lumen of the intestine while preserving tissue viability. The jaws are wide and longitudinally ridged, creating a gentle but firm hold that prevents spillage of bowel contents without compromising perfusion. You'll typically see it used in small and large bowel resections. During a right hemicolectomy, for example, 2 Dennis clamps are placed, one proximally on the ileum and one distally on the transverse colon, to isolate the segment for resection and prevent contamination. Its smooth, non-crushing profile makes it safe for temporary bowel occlusion during anastomosis or resection. Unlike crushing clamps that can damage the mucosa, the Dennis allows for safer healing margins. Pearl. Use 2 Dennis clamps spaced apart to create a bloodless and contamination-free field. The interposed segment becomes your clean surgical zone. Pitfall. The Dennis is designed to preserve tissue. Applying a crushing clamp in its place can compromise blood supply and increase anastomotic leak risk. Kelly-Rankin hemostat. The Kelly-Rankin is essentially a deep-field version of the standard Kelly clamp, available in both curved and straight configurations. It has long jaws and longer shanks, which make it ideal for reaching deep within the pelvis or retroperitoneum. In cases like a splenectomy or deep pelvic dissection, the Kelly-Rankin provides the reach you need to isolate vessels or perform blunt dissection far from the surface. Its fine serrations provide a secure grip for hemostasis or controlled tissue spreading. It's often used for splaying apart tissue layers, gently teasing open fibrous planes, or exposing major vascular structures deep in the field. Pearl. The Kelly-Rankin is excellent for deep dissection and clamping in narrow, obscured fields. It shines when visibility is low, but precision matters. Pitfall. Be cautious with its length. You'll get less tactile feedback compared to shorter hemostats. Over-clamping without full control can damage unseen structures. Satinsky clamp. The Satinsky is a specialized vascular clamp known for its unique jaw geometry, angled, sweeping, and elongated. It's made to partially or fully occlude large vessels without completely disrupting blood flow, making it essential in vascular, hepatobiliary, and transplant surgeries. During IVC repair or hepatic vein reconstruction, it allows you to control the field while still maintaining partial perfusion. The jaws curve around major vessels like the inferior vena cava or portal vein, offering a secure yet non-traumatic hold. Satinsky clamps come in various lengths and angles. Choosing the right variant based on vessel size and angle of approach is critical to avoid kinking or twisting the vessel. Use a Satinsky clamp for partial occlusion, for example, to repair one side of a large vein while the other remains perfused. Pitfall. Misalignment can be dangerous. The vessel must sit flush in the clamp's curvature. Twisting or over-rotating the instrument can shear or crush the vessel wall. Israel rake retractor. This instrument looks like a garden rake, and that's not far off. The Israel rake is a powerful handheld retractor with multiple prongs that come in either blunt or sharp varieties. It's used for lifting thick, fibrotic tissues such as fascia and muscle. In abdominal wall reconstructions or orthopedic surgeries, it can be used to retract dense tissues with excellent mechanical advantage. Its broad handle gives the assistant control and comfort, even under prolonged tension. You'll also see it during retroperitoneal exposures, where heavy muscular layers need strong retraction without relying on self-retaining systems. Pitfall. Sharp rakes can tear tissue or cause nerve damage. Ensure clear visualization before engaging prongs, and don't use excessive force during retraction. Murphy retractor. Elegant and compact, the Murphy retractor has a curved blade and a finger ring handle for controlled retraction in tight spaces. It's often used in neck dissections, thyroidectomies, and vascular procedures where traditional retractors are too bulky. Its gentle curve allows you to lift tissue out of the way without obstructing your visual field. The ring handle design enables precise positioning and steady hand control throughout the case. You'll often see it paired with fine dissection tools when working around critical structures like the carotid sheath, vagus nerve, or thyroid vasculature. Pearl, ideal for delicate procedures requiring gentle, precise retraction in a confined space. It provides stability without bulk. Pitfall, it's not built for tension. Attempting to use it for heavy retraction can cause it to slip or fatigue the user's hand. Alexis wound retractor. The Alexis wound retractor is a self-retaining atraumatic retractor designed to gently hold open the edges of an incision, often in laparotomy, C-section, or bowel resection, without the brute force of metal blades or prongs. Think of it as a circular plastic ring with a transparent, flexible sheath that creates uniform radial tension on the wound edges. The Alexis provides 360-degree circumferential retraction, dramatically improving visualization and access, while also protecting the wound from contamination and desiccation. It's often used in place of handheld or bladed retractors, especially when soft tissue preservation is important. The Alexis comes in various sizes, typically extra small to extra large, and is chosen based on the expected size of the incision. It has two semi-rigid rings. The inner ring is inserted into the abdominal cavity or tissue plane, and the outer ring is rolled down along the sheath to create tension. As the outer ring is rolled, it stretches the sheath taut, which then pulls evenly on all sides of the incision. This spreads the wound open without focal pressure points, reducing ischemia and trauma to the skin and fascia. You'll most commonly see the Alexis in laparoscopic-assisted cases like hand-assisted colectomies, where the incision needs to stay open just wide enough for a hand or instrument exchange, and in C-sections, where preserving the integrity of the wound edge is critical for both healing and cosmesis. Pearl. The Alexis doesn't just provide retraction, it also acts as a wound protector. The transparent sheath forms a barrier between the wound edge and bowel contents, decreasing the risk of surgical site infection. Pitfall. Improper sizing is a common error. If the Alexis is too small, it won't hold tension and may pop out mid-case. Too large, and it can cause undue stretch or interfere with instrument movement. It requires precise insertion technique. If the inner ring isn't seated correctly, it won't grip the wound edge properly, and you might waste time adjusting traction. Goelet retractor. The Goelet retractor is a low-profile, handheld instrument with two differently sized, curved blades at either end. This double-ended design offers versatility, one side for shallow retraction, the other for slightly deeper exposure. It's used in a variety of general, vascular, and endocrine procedures, where fine retraction is needed without bulky self-retainers. Common use cases include thyroidectomies, femoral artery exposure, or inguinal hernia repairs, anywhere you're working in a narrow or superficial field. The blades provide gentle spreading of subcutaneous tissue, muscle, or fascia with minimal trauma. Pearl. The Goelet is perfect for slim patients, pediatric cases, or soft tissue exposures that don't require strong leverage. Pitfall. This retractor isn't meant for aggressive retraction. Forcing it into deeper spaces can cause blade deformation or hand fatigue due to constant holding pressure. Singley tissue forceps. Singley tissue forceps are broad, fenestrated graspers designed to hold delicate structures like omentum, bowel, or surgical sponges. The jaws are flat, smooth, and rounded, minimizing the risk of crushing or tearing tissue. Their design prioritizes gentle handling of fragile structures, especially those saturated with fluid. In abdominal surgeries, they're commonly used to guide moist gauze into cavities, gently hold viscera, or reposition bowel loops without trauma. Their size makes them especially effective for guiding lap sponges into place or retrieving small foreign bodies without damaging the field. They're also used in thoracic surgery when manipulating the lung parenchyma or placing sponges around the heart, places where other forceps would be far too traumatic. Pearl. Use Singley forceps when working with fragile or soaked tissue. They give you control without injury. Pitfall. Don't mistake them for hemostats or pickups. They won't securely grip tissue under tension or during suturing. Use toothed pickups or adsons for that task. Carmalt clamp. The Carmalt clamp is one of the most recognizable heavy-duty clamps in open surgery. Its long jaws have longitudinal serrations along most of the surface, with cross-hatching at the tips. This combination provides secure crushing force while maintaining directional control. It's especially useful for ligating vascular pedicles during organ resections. You'll see it in open hysterectomy, bowel resection, or splenectomy, where it's used to clamp, crush, and prepare large vessels or tissue bundles for ligation or cauterization. Carmalts are also ideal for grasping thick tissue masses that need to be sealed before transection, such as mesentery or uterine pedicles. Pearl. If you're removing something big and bloody, reach for a Carmalt. It grips, seals, and preps tissue for ligation better than almost any other clamp. Pitfall. Never use it on tissue you intend to preserve. The crushing effect is deliberate and permanent. Mistaking it for a non-crushing clamp can lead to tissue necrosis or delayed hemorrhage. Heaney Clamp. The Heaney Clamp is a staple in gynecologic surgery. It features a curved jaw with fine serrations and a single tooth at the tip for anchoring onto tough, slippery structures. It's designed to ligate vascular pedicles and fibrous ligaments in the pelvis, such as the uterine artery or cardinal ligament. The curvature of the jaw aligns with the natural angle of pelvic anatomy, allowing it to seat securely around vascular pedicles without slipping. It's also seen in urologic and oncologic surgeries where dense fibrous tissue needs to be clamped quickly and securely. Pearl. The single tooth and curved jaws give you superior control, especially in slippery, fibrous, or vascular tissue planes. Pitfall. Align the clamp properly with the tissue's curvature. Poor angling can shear vessels or displace the clamp, leading to bleeding or tissue trauma. That's part 5, the final installment in the Core Surgical Instrument Guide series. With these last 10 entries, we've now covered 50 critical surgical tools every medical student, scrub tech, and junior resident should know by sight, feel, and function. From bowel clamps to deep retractors, every tool has its place in the OR, and understanding how and when to use them is just as important as the procedure itself. If you found this guide helpful, hit subscribe, share it with your classmates, and check out our full playlist for more surgical education. We'll see you next time in the OR.